Changing weather here in Colorado is really affecting our health and the impending flu season. So that's why we sat down with 9 health expert Dr. Payal Kohli to talk about what we can do now to make sure we're staying healthy during flu season. Dr. Kohli, thank you so much for joining us again. I don't know about you, but I'm looking outside my window right now and I'm already seeing the leaves changing. It's making me a little nostalgic. I love it.
I love the snow, so I was very happy to see that weather change happen.
Yes, me too, absolutely. So we're talking changing weather today, especially how it pertains to our health and the upcoming flu season too. So how is this changing Colorado weather affecting our health right now?
It's interesting that you ask because a change in weather, especially cold weather, and a drop in barometric pressure, which means dry weather, can really do a lot of things to impact our respiratory health and increase our susceptibility to respiratory infections such as COVID-19. And there's really 3 main reasons for that. The first is that viruses survive longer in cold, dry weather. So they really do like the winter. And, that's just a fact. So we'll have to keep that in mind because the COVID-19 activity, flu activity, and other viruses is going to start to go up. The second is that our immune systems are actually weaker in the cold weather. And that's because when the weather's cold, our blood vessels constrict and all those infection fighting cells are diverted away from our mucosal membranes, our nose, our eyes, our mouth, our throat, and our lungs. And so those are our first lines of protection really with the environment, and they get diverted away. The dry weather can also cause cracking of those mucous membranes, as we're all familiar with, so that can increase our risk. And then the final is behavioral. People tend to congregate indoors when it's cold, and that facilitates the spread of respiratory infections.
Okay, so you got to keep that social distancing in mind. And then, of course, when mom told us to bundle up in the cold, she was being serious. Perfect. So in terms of differences in the coming flu season, should we be worried about that too, especially with COVID-19 right now?
Well, it's interesting that you asked that because there is data from the Journal of Clinical Virology that says that the first cold, dry front actually kickstarts the flu season. And this was data out of Sweden 3 years in a row. They saw that about a week later is when the flu season got ushered in. So now here in Colorado, we did have moisture come in with the cold weather. We had the snow come in as well. So it may not correlate exactly, but I'm concerned that this cold weather could really have ushered the start of the flu season earlier than we might have expected this year.
Okay, yeah, I'm a little concerned about that too. So we always hear about, vitamin C, making sure that you're, getting your proper diet and exercise. What are some ways that we can make sure that we're taking care of ourselves pre-flu season?
So I think you're exactly right. You want to make sure you have good nutrition because vitamin deficiency can compromise your immune system. The sleep is important, minimizing the alcohol, staying hydrated. But I also really want to emphasize that it's more important this year than ever to get that flu shot. And there's really a sweet spot for when we should be getting the flu shot so that we're not getting it too early and unprotected late in the season, but at the same time, we're not getting it too late. So I tend to recommend people to get it late September, early October, because that really kind of helps line up when your immune system will kick in after the flu shot to when the peak flu activity is going to occur.
Okay, so getting that in our calendar is super important this year. And, as we continue to head into flu season, especially with everything going on with COVID-19 right now, how can we tell the difference in symptoms if we're feeling a little under the weather? We don't want to jump immediately to, okay, I have COVID. So how do we tell the difference if it's the flu versus COVID?
That is a real challenge because there is so much overlap between those two conditions. Now, COVID does tend to involve the lungs a little bit more than the flu, so you may have more shortness of breath. But the other symptoms, the fever, the cough, the muscle aches, the malaise, all of those can be overlapping. So thankfully this year, the CDC has developed a test that checks for both influenza A, influenza B, as well as SARS-CoV-2, which is the virus that causes COVID-19. Now, this test is not available at every single lab, so make sure you talk to your doctor if you are feeling some symptoms, because most likely you are going to get checked for both. And again, that's another reason to get the flu shot this year, because if you do end up having any kind of symptoms, even if it's the flu, people are going to think it's COVID-19. You may miss work. You may have to avoid seeing your family and friends, and it's really going to have an impact on your life.
Yeah, and that goes all the way back to the coronaphobia discussion we had a couple weeks ago. So very important to get that flu shot. Dr. Kohli, thank you so much. We appreciate you keeping us safe.
My pleasure. Thank you.
Make sure you're in good health. 9Health is working to keep you safe with their at-home screenings. Just head to 9healthfair.org to get a health kit today. And 9Health fairs are back. Head to their websites to find out where and when you can attend. Make sure to tune in on Wednesdays as we dive deeper into the flu shot at the 9Health Fair. And Amelia, I actually went and got my flu shot at the health fair. My arm was hurting, but it was totally worth it.